Hello, Assalamu alaikum. How are you? Fine. This is Jamil Ahmad Nizamani from Pakistan for the cervical dystonia management. This requires diet management, posture management, and also sleep management, sleep close management. What these things do you want to know more about? I am here live with you. I was diagnosed with dystonia in 2013, though I was suffering from early 2000s, especially in 2005. I was very, uh, I had severe cervical dystonia. In 2005, I was bedridden. I felt that I will never be able to walk again. I was feeling so much the effect of dystonia. So I am managing it very well without Botox, without any medication, just two medications, two medicines I use, help, you could say that Xanax and Regex. These two manage my dystonia very well, though doctor has prescribed me Kemadrin. My neurologist had prescribed me Kemadin that I took for about 10 months. You know what happened? I had continuous infections in my eyes and mouth infections. So I was really feeling unwell. Then it came into my mind because Kemadin was creating dryness in my mouth. So I was having infections. Kemadin was creating uh, dryness in my eyes, so I was having infections. In 10 months, about 2 to 3 times I got infection in my mouth, and same way I had infections in my eyes. Saliva secretion was decreased, so I was having infections in mouth. Ultimately, I decided to stop taking medication. I stopped Kemadrin. So this way, then I decided to manage my movements, and I have especially feeling I'm feeling very well after diagnosis of diabetes. I was diagnosed with diabetes in 2018. Then I managed my diet. Since I'm feeling very well, I'm feeling much better. So whether you are watching this right now or anywhere in the lifetime you watch this my live stream, you could ask me any questions. You see, there is a tilt in my head still, but I'm feeling much better. I'm doing my everyday life works. I have just some problem while walking in open spaces. Otherwise, I am quite living a normal life, a healthy life, and my quality of the life is much better than 2005 when I was not that much aged. It is about my date of birth, though mentioned in the certificate is 1972, but somehow I think it was 71. I don't exactly, either you count it from 71 or 72. How old was I in 2005? If we count it from 72, 72 to 70 or 2005, I was about, you may say, 8 and 8 and 10, 18. 8 and 20, 28, 28 and 5, 33. Then I was 33. And now, what is my age? You can watch my gray hairs. Watch my gray hairs, but watch my tilt also, but see my healthy face, healthy speaking way. Everything is fine for me right now. See my hands. So now, how old am I? I am 28 years and 26 years. These becomes 54. In 2005, I was just 33, and currently I am about 54 years age, still living a healthy life with dystonia. So, uh, if you need any kind of help, share my this live with the people who are suffering from cervical dystonia or who needs anything regarding dystonia. What do you want to know? I am available. I will be coming live now. In the past, I did not have that good internet connection that I have available right now. So I will keep coming for live sessions on YouTube on this my channel. So if you want to join me right now, I am available for suggestions, for recommendations, for guidance, whatever you call it. But I am certain that you will be able to get advantage from my experiences. Whether you are whether you are a young man or you are an old man. Sometimes I get calls from overseas and around Pakistan, especially young people who has been diagnosed with cervical dystonia lately. They need too much support because the feelings of dystonia are so what should I say, so painful and so frustrating that the person who has have this issue really will be very frustrating. Really will be very in frustration. So anyone who needs help regarding this, I am available right now. Whenever, wherever you are in the world, who is we are the family. We are pain fellows. We have same issue. So we need to connect with each other and on a forum that we are able to know that this is not an issue that is too much. We have to manage things. We don't have to take too much weight. We have is do not we do not need to stretch ourselves for movements. So because dystonia in some ways is better than, I am using the word better than. What word I am using? Better than. Better than Parkinson's and essential tremor. The three most common neurological disorders in the world right now are dystonia and especially cervical dystonia and essential tremor and Parkinson's. Parkinson's is very dangerous compared to dystonia because it affects our it affects human psychology, brain cells. But dystonia has nothing to do with it. Dystonia, the person who has dystonia is a very intelligent person. He is wealthy. I must say he's healthy. Just he has to manage his movements. He has to manage his diet. He has to manage his emotions. There are three or four things to manage: diet management, posture management, and emotions management. If your emotions are managed, how do we manage our emotions? The major thing that keeps us normal, we are not that much emotional. It is our speaking way, our attitude. Speaking slowly and not loudly is the thing that keeps our emotions in check. We have to keep ourselves managed in all ways. Another thing is that we shouldn't feel that we are not normal. We are normal people living normal life. We don't have to feel that we have psychiatric issues, because in the beginning, when I was not diagnosed in 2005, I went to Karachi Nagan Hospital and other hospitals where neurologists couldn't find any diagnosis for my dystonia. I was called that you have depression. One neurologist, very renowned neurologist of Pakistan, then his name was I am trying to uh, I'm trying to recall his name. His name was I'm not able to I don't know his name. I know his name. I think he was as it comes in my mind. I'll let you know. But he told me that you don't have any neurological disorder. You have depression. I said okay. This isn't any issue. Then refer me to any psychiatrist. Then he suggested me one psychiatrist that was not available at that time. And the second, the name, what was his name? Went to, I got appointment of, it was Naim Siddiqui, I think, yes. But as you know that I hadn't any issue, he told me that you have somatic depression. But I had not somatic depression, I had dystonia. So I think we don't need to feel anything wrong about our nature, about our issue, about our health. We must feel comfortable. We must learn how to move, how to sleep, how to eat, what to eat, when to eat, and manage our postures. I tried many flows, but for the current setup, I'm really comfortable with. I use three set of clothes. You could be watching my bed from here. I think it is watchable. So I am going to show you my clothes system that is really working very good for me. Now let us see this. Here I have my setup. Here I have three clothes, and this is the flow that I use as upper. From to the upper level, this is the flow from the side, and this is kept vertical. Vertical, this is here, and this is the flow that I use horizontal. The flow is here, this is horizontal, this is vertical, and this is the third one, that is the I keep it like this. This is somewhat raised, and I sleep like this. So this is the my flow system, and I like to sleep on the bed. I don't sleep on hard surfaces because they are quite discomfortable, and when there is hard things, it is really difficult to sleep. So for the current session, I am leaving right now, and I'll be back in another any live stream when you share my stream. You ask me something in the chat or any kind of guidance you need. Thanks for watching. Bye for now. I'll be coming in another video or live stream. Bye for now.